Flowcharts are common in the medical literature, especially in randomized controlled trials, and in this section we'll discuss their purpose and how to interpret them. There are two main reasons a flowchart is included. First, to assess external validity, and second, to assess internal validity. And recall from the data collection section that the external validity refers to the ability of a study to generalize to the target population. A flowchart will describe how individuals are selected and enrolled in order to help the reader assess whether the sample is generalizable to the target population. Internal validity is essentially how well the study is designed. Some issues that a flowchart can reveal are non-random treatment assignment, systematic loss to follow-up or dropout, patient non-adherence, and not analyzing all participants. Non-random treatment assignment subjects a study to the potential for confounding. Recall from the data collection section that confounding occurs when the relationship between two variables is distorted by a third variable. Systematic loss to follow-up describes the occasion where participants drop out of a study in a systematic way, changing the results of the study. A flowchart will often describe how many participants were lost to follow-up. While this is often unavoidable, it's important to understand how many were lost along the way and whether more were lost along the way in one group than another. Patient non-adherence refers to participants deviating from the trial protocol. Participants may, for example, discontinue the intervention, and if this occurs systematically, for example, more often in one group than the other, it can introduce bias. Depending on how the study is set up, this non-adherence is sometimes unknown. So not analyzing all participants. In addition to the previously mentioned reasons for losing participants, sometimes the data analyst will exclude participants post hoc from the analysis. This can often introduce biases and ought to be reported in a flowchart. So in 1996, the Consolidated Standards for Reporting Trials, known as CONSORT, criteria were published. This was most recently updated in 2010. The document includes information that ought to be reported for randomized controlled trials, as well as the format for a flowchart that describes how participants pass through the phases of the trial. More information can be found at www.consort-statement.org. We'll step through each of these phases and describe what to look for when reading these flowcharts in the medical literature. The first phase of a trial to consider in a flowchart is the enrollment phase. This will help you understand the external validity of the trial. The flowchart will describe how many participants were assessed for eligibility and how many were excluded. This should include reasons for exclusion, such as not meeting eligibility criteria or declining to participate. Included in the enrollment phase is a count of how many participants are randomized. The allocation phase describes how many participants were allocated to each treatment. Here you want to understand whether the patients randomized were actually allocated to the treatments to ensure that randomization was upheld. In follow-up, you're concerned with two threats to internal validity: loss to follow-up and non-adherence. And then the final phase, analysis, is the catch-all. Any patients that were excluded for reasons not previously specified should be detailed here. Now let's examine an example from the literature. Recall the closed trial from the study design section. You can read the full article in PLOS One. So this trial included a consort-style flowchart, so let's step through it. In the enrollment phase, they began with the number assessed for eligibility 922. They then described that 622 were not randomized, 326 did not meet eligibility, 97 did not give informed consent, 187 did not respond, 7 were not included for other reasons, and 5 did not attend the baseline appointment. This leaves 300 participants for randomization. These 300 were split into two groups. 151 were allocated to standard of care, and 149 were allocated to the intervention. One patient was sent silk clothing in error, reducing the standard of care group to 150. So follow-up. The follow-up is split into 3 time points: 2 months, 4 months, and 6 months. Notice that adherence is not detailed in this flowchart. For this information, we need to look at the main text. At 2 months, the rates are similar across treatment groups, with 10 in the standard of care group discontinuing compared to 7 in the treatment group, and 4 that did not attend the follow-up visit in the standard of care group compared to 3 in the treatment group. At 4 months, the number of participants discontinued in each group was 10. However, 8 didn't attend the visit in the standard of care group compared to 4 who did not attend the visit or did not have the outcome fully assessed in the treatment group. Since the rates in the other months is pretty consistent, this discrepancy is likely just due to chance, but it's always worth keeping an eye on this. Finally, at 6 months, the rates seem similar across groups, with 12 discontinuing in the standard of care group and 15 discontinuing in the treatment group, along with the one where the outcome was not fully assessed. Finally, we can look at the number included in the primary analysis. In both groups, 141 were included in the final analysis. Notably, all 151 randomized to the standard of care group and all 149 randomized to the treatment group were included in the sensitivity analysis. Researchers are able to do a sensitivity analysis include everyone by assigning or imputing values for participants that were missing from the final analysis.